So let's take a look at the latest. And with us again is Dr. Brian Harrington. Dr. Harrington, how are you doing?
I'm fine. Hello, Eric.
Hey, thank you for joining me again this morning. We just recently had some talks about moving some elementary school students into full-time in-person teaching. Can you tell us the latest on that?
Sure. And I'll start by just kind of discussing where we are, and then I'm going to wrap it up by kind of our latest position on that. So in recent weeks, we've been discussing with the Steamboat School Administration about opening up their elementary classes to 5 days a week of in-person education from what they're doing currently, which is just a couple of days. Our other two county schools are in 5 days of in-person elementary school education. That's gone well for them. We have not seen many cases in our schools yet, and we remain, very proud of the work that our schools and the teachers are doing as best as they can, but to limit the risk of spread in the school. So with that context and other issues involving the spread of disease at that young age and what the risk is, we have been supportive of the schools looking to open up as a first step K through 2. And so up until this week, that was certainly something that we were, in fact, just as early as Monday, I was supporting that. However, this week we have seen a significant jump in our cases in our community, which have pushed some of our kind of markers for concern. And as such, we, and I think the school administration is kind of taking the same direction. We want to continue looking at how that could work to open up, but we're not going to be pulling that cord right away. I think from our standpoint, public health now, that we want to watch the next couple of weeks and see what the trend is, because certainly if this big rise we had this week continues, then we will be getting into a danger area, and we don't want to be there.
So you speak of a rise that we had this week. What sort of a rise, and what do you think the causes are? Talk to me about this rise.
Yeah, so the bad news part of it is that we had the highest number of cases in the past week, and in a 2-week period that we've seen, or that we've documented so far in this pandemic. So we documented 31 Routt County residents had positive COVID tests in the past 2 weeks, including 21 just in the past week. And we could even have a couple tests that still stagger in that would add to that a little bit. Regardless, that does represent a significant change in our status. And we see these kind of ups and downs. But frankly, since September, we've never really quite settled down. And I would suggest that we're now in what I might call our third local wave. We saw a first wave back in March and April timeframe. We saw a second wave kind of in July, after July 4th, and then our cases kind of settled down in August. In fact, we had a week with no cases. And then in September, presumably related to the Labor Day weekend, we saw another wave of cases. We've never really settled down from that wave. And it's possible that, like the rest of the state and the nation, we're just now kind of on this kind of gradual climb up in our case counts, which obviously will put us into more of a dangerous situation with having more disease around as we get to it. With each of those waves that I just mentioned, say the first 2 waves, we saw hospital admissions and we saw deaths in our county, which intuitively makes sense. The more disease you have, the more the risk there is for especially our vulnerable people in our community. And I want to emphasize this point, that as we all kind of look at our own risk, the majority of us are actually at relatively low risk of serious complications from COVID-19. But I want to emphasize that it's not just about us. It's about what we do that impacts the safety of those around us. So to my point, when we have increased spreading of disease and cases in our county, we see more admissions, we see more people intubated, we see more deaths. It follows from that. So it's important for all of us to continue our mitigation efforts for the sake of all the others in our community, if not for ourselves.
You said that after 4th of July, which is a big social event for everybody, we saw another boost in our numbers. We're entering into another holiday season, Halloween, with already an increased number. Is there concern that that after Halloween we may see even this wave trend continue on the upward climb, or what?
Yeah, I suspect there will be an impact of some sort, although it can be hard to discern that. Halloween's not a holiday when we see people traveling like we do, say, the 4th of, necessarily 4th of July or Labor Day or Thanksgiving. But probably the risk there is the gathering of people. And so, it's the time of year that many of us participate in Halloween parties. I would suggest this is the year to maybe forego a Halloween party. The whole, the spread of COVID can be reduced to a math equation, kind of. It's how many people are you in contact, how long, what's your risk, and so the more contacts you have, for example, the more the risk, and the more the spread. So we're kind of in a critical point here for the next few months until we start to see the vaccine in significant numbers. Until we get to that vaccine point, we've got to continue and buckle down with the things that we have been doing. I know that everybody's got fatigue. I've got fatigue with masks, with all the curtailment of things. I think we need to carry on just a few more months. I'm encouraging everybody to buckle down.
Buckle down, everybody.
Buckle
And if
down,
you are,
I guess I should say.
yeah, host a virtual Halloween party like this, and even then, wear a face mask. This year would be a good year for a Halloween costume with a mask, would it not?
Yeah. I suspect that
Um,
there's people even making Halloween masks that now are properly made so that it fits COVID suggestions. But
yeah. Um, do you care to talk about the 70 students in the high school that are in self quarantine? What sparked that, and what we
yeah,
can
I
see
can
from
talk about
that?
that in general, and it's similar to the other two school cases that we've had. When we have a student who's positive, we do place that whole cohort in quarantine, and that includes teachers with them. Now, with the elementary school and the middle school, that is tends to be a lower number, right? Because we've got a class of 15 students, and it literally can be as small as that class alone gets quarantined along with the teacher. Now, one of our earlier situations, the positive case had ridden on a school bus, so we had to quarantine that school bus and those occupants as well. With the high school, though, the numbers are more challenging because it doesn't work out that a student is just in kind of one class cohort the whole way through the day. No, they're in 4, 5, 6 different classes. And so each of those classes becomes its own cohort. So when we have a high school student who's positive, we must therefore recommend quarantining the teachers and students in each of the classes that student was in. And so that's how you end up with kind of a bigger number. We don't have 70 cases. We have one case in the high school, but unfortunately we now have that number of 70 or whatever of people who, because they qualify as close contact, they must now be in quarantine.
Well, Dr. Harrington, thank you for sharing all the latest updates. I really do appreciate you coming on air and informing the community. And let's just keep informing and keep learning. We're in this together.
Indeed. Thank you, Eric. Good to see you.
Good to see you as well. So, guys, it's not over yet. We have more to go, but we can do this. Let's wash our hands. Let's wear our masks. Let's socially distance and do what we do best here in Steamboat, recreate outdoors. Stay tuned. We have more show coming to you right after this.